Everyone in healthcare has a story they never forget. Some are beautiful, some are difficult, and most are never told. This is the space and place where doctors talk about the moments that change them. Welcome to HUMED, where we talk about the emotional, moral, and human realities of medicine. I'm Dr. David Spiro. Thanks for being here. Please hit subscribe wherever you get your podcast information. I'm incredibly delighted and honored to have a colleague that I've known for at least 5 or 6 years, Dr. Greg Albert. He's a pediatric neurosurgeon and the chief of pediatric neurosurgery at Arkansas Children's. He spent his career caring for children and families who face some of the most frightening and life-altering moments imaginable. He's trained at places like Tufts, the University of Iowa, and Toronto's Hospital for Sick Children. Dr. Albert is nationally recognized for his work. But I think what truly defines him, because I know him personally, is the way he shows up for patients, families, and colleagues. We work together very closely in the pediatric ED, like most do with our neurosurgery colleagues. His work lives at the intersection of technical excellence and deep compassion for the patients we serve. And today, we're honored to have him on the show. Dr. Albert, thank you so much for being here.
Thanks for having me. This is a real pleasure, and it was honored to get your invitation.
Yeah. So let's get into it. Tell us, I don't know what the story that you'd like to share, and I know we talked a little bit before the podcast about what this is all about. So fire away. Tell us a little bit about what story you'd like to share with us today.
Yeah. So it's actually a series of short anecdotes, but what I'd really like to start with, because it's fresh in my mind, is a story about my mentor from residency. He passed away recently, and he's really the one who inspired me to become a pediatric neurosurgeon. Because as a young third-year resident, I was able to see him interact with the patients and families that he cared for and see what kind of a deep, meaningful connection he developed with the families and patients that he cared for over a very long career, nearly 50 years long.
Wow. And what institution was that at?
This was at the University of Iowa. His name was Dr. Arnold Manizas. Some listeners may know him. He was truly an internationally recognized expert in his field. And I was honored to be able to give his memoriam at our national meeting recently. But I recall working with Dr. Manizas, and one of his mantras when he spoke with his patients' families was that he would treat the children he cared for as if they were his own. And I saw that firsthand as I was working with him, and I saw the kind of lasting connections that he developed with patients over many, many, many years, to the point where numerous of these patients from around the country showed up for his funeral because he had made such a deep impact on them through the care that he provided and the caring way in which he provided it. And what it showed me, and we can get into this a bit more, is that for us as physicians, when we go to the hospital, when we go to work, it's another day at work for us. But we always need to remember that for the patients we're serving and the patients we're caring for, it's really a life-changing day for them. So when I do surgery on somebody, be it for a trauma or a brain tumor, or one of the epilepsy surgeries I do, for me, it's a day at the office. But for the patient and that family, this is something that's going to irreparably alter their lives, hopefully for the better, but not always. And I was further reminded of that even more recently, another brief anecdote, when some colleagues of mine were out to dinner here in Little Rock recently. And it just so happens, this was pure coincidence, we were seated next to a family at the table next to us. And they came up to one of my colleagues, one of my partners, Dr. Tanaka, and said, "I don't know if you remember us, but you operated on our son 5 years ago." And when their son was very young, he had had a trauma, a skull fracture, which Dr. Tanaka had to operate on. And he's doing great. He's recovered completely. But again, 5 years ago, that was another day at work for Dr. Tanaka. But this family remembered that to this day, to the point where they felt like they needed to come up and say thank you for the care that she had provided, for the life that she had given their child these last 5 years. And they ended up paying for our dinner unbeknownst to us, as a way of saying thank you. So these sorts of things, they're not the everyday things that we see in the hospital, but they're things that really stick with me and demonstrate for me the importance of what it is we do when we take care of patients and families.
I really appreciate that. So I want to get back to your relationship with Dr. Manizas, who seemed to have an incredible impact, and I'm sorry about the loss. He, when, and I'm not a surgeon, but I imagine there's lots of different various forms of mentoring in the surgical world in terms of developing technical expertise, which you never really described about that with him. You really talked about the way that he engages with families. So I'm curious, did you learn different things from different mentors along the way? And what about what he was doing really imprinted on you and you took away to give to the families you serve?
Yeah, so I think there's this stereotype of neurosurgeons that neurosurgeons tend to be a bit aloof and off-putting, and they don't really care about the human side of medicine. And perhaps it's a bit unique. Well, I don't think it's unique, but it's certainly found more in pediatric neurosurgery, where we really, part of the reason we go into pediatric neurosurgery as opposed to other fields of neurosurgery is the opportunity to develop these long-term connections with patients and their families. And I learned a great deal from Dr. Manizas, surgical indications, surgical approaches, um, the technical aspects of being a neurosurgeon, but it's really these human aspects that have stuck with me the most, especially the further along I've gotten in my own career. So I've been practicing at Arkansas Children's now for nearly 15 years. And early on, you tend to focus on the technical aspects. Can I do this? Am I doing the right thing? But now that I have my own patients who I've been seeing for the last 15 years, in some cases, I operated on them the day they were born and now they're 15 years old. In other cases, they're people I started caring for when they were, you know, 10 years old, give or take. And now they've graduated from college, preparing for medical school. One of my former patients recently invited me to her wedding. And these are the sorts of things that, um, it's these sorts of connections that really inspired me about Dr. Manizas, especially at the end of his life when, at the funeral and at the memorial service, all these patients started sharing their stories about how he had impacted them. And having seen firsthand how he interacted with patients and their families in the clinic and on the hospital wards really starts coming back to me and shows me what kind of neurosurgeon, what kind of physician I can be and I should be.
So is it fair to say, well, that's beautiful, Greg. So is it fair to say, and I want to understand what you said earlier on in your career, and it's the same for pediatric emergency medicine. We focus on procedures and becoming technically proficient in things and moving patients through. But oftentimes, at least in peds ER, what drives many of us, including myself, is the ability to engage with families in a meaningful way and have that emotional connection with them in the ED. What has changed for you? What do you, in terms of when you spend your work day over the course of any day that you go in, you are mentoring residents, you are working with colleagues, you are engaging with families. What gives you the most satisfaction in your career at this time?
Well, it's really two things. It is that continued relationship with patients and their families and developing that connection. Sometimes on very short notice, we're asking families to allow me to do honestly, really crazy things on and to their children, sometimes having only known me for minutes. But then mentoring the next generation of neurosurgeons is also incredibly important to me, and try and instill in them some of these qualities that I've learned from Dr. Manizas and other mentors of mine of how it is that we go to work every day and treat families treat patients not as another case to be done, not as another, notch on your belt or RVW to accumulate, but as people with unique histories and unique stories, who you can have a really deep, meaningful impact on. Um, and you can do the best surgery in the world, and you can do a technically perfect operation with the perfectly selected patient. But if you don't treat that patient as a person, forevermore, they're going to have a negative association with that experience, and they will not forget it. From my own personal life, so I have a brother with Down syndrome he was born when I was 9, almost 10 years old. And my parents, when the doctor shared the news with my parents, what the doctor said, the pediatrician said to them was, "Oh, you have a 9-year-old son." And my parents said, "Yeah." And they said, "Well, this is great. It'll be like having a 9-year-old son forever," which is a pretty shocking thing to say to somebody when they've received news that their newborn baby boy has Down syndrome. And I am 100% convinced, 100% certain that that doctor obviously meant no harm by it. Again, another day at the office, and probably has no recollection of that encounter whatsoever. But my brother is now 40 years old, and my parents still remember that interaction.
Wow.
40 years later.
Wow.
So I try and remember for myself, but also in part upon my own trainees, that's the kind of impact that we have to families who are in very, very high stress situations.
Do you think that your brother's diagnosis and your brother having Down syndrome had an impact in your interest in going into pediatric neurosurgery and/or medicine?
Medicine for sure. Pediatric neurosurgery probably. But that anecdote in particular definitely impacts the way that I see families and talk to patients on a day-to-day basis.
For those who are listening, who are young learners, one of the things that I do when I see children with developmental disabilities, whether it's Downs or other syndromes or children with other chronic health problems, I always make a point to tell families they're doing a great job taking care of their child, because I have never lived in a family with a child with Down syndrome, but I imagine it requires a lot more attention and thoughtfulness and just overall energy managing a child who at times may or may not struggle in the world. And I also tell specifically families with kids with Down syndrome, and this is true. And again, this may be my own imaginings, but Down syndrome and kids with cystic fibrosis, they are almost always the sweetest, most kind and loving children. All
Mm-hmm.
children are loving and sweet and kind, but there's something extra special about children with Down syndrome that I can't describe, but they're just incredibly loving and sweet kids. Has that been your experience with children with Downs?
For sure. And I mean, you know this, but not all of the listeners may know that Down syndrome is associated with problems with the neck where the skull meets the spine. So we actually see a fair number of Down's children in our clinic to follow up and do routine monitoring of this condition. And I had the same experience. And every time I see a patient of mine in clinic with Down syndrome, I think of my brother, and I think of that interaction that my parents had with that doctor 40 years ago.
Wow. Have you ever
And that's something that I don't want to recapitulate.
Yeah. Have you ever told any of your patients that your brother has Down syndrome?
A few of them that I've gotten to know well over the years.
Mm-hmm.
Because
Mm-hmm.
again, this is another category of patients where some of these patients I've been following for 15 years, my entire time here. So you really get to know the patients and families. And back to your point about telling families that they're doing a great job. The other time that I found that um, is with families at the end of a child's life. So be that from most often it's in my world, it's trauma or cancer. And especially with cancer, where it's so hard on families when they have a child who goes from perfectly well one day to this potentially devastating diagnosis the next. And it can be a years long process of surgeries and chemotherapy and radiation. Um, and eventually the child reaches the point where there's nothing more that can be done. And families inevitably have a lot of guilt about that, and trying to reassure families that they did everything right, that they did everything they could for their child. And at some point it is compassionate to uh, make the child comfortable as they pass on into the next life, depending on your faith belief. But again, helping alleviate that guilt that many families have about the condition of their children and making them know that it's not their fault, that they have done everything right, that they've done a great job, just like you said. One of the things that this has actually been studied, there's a publication on this, why neurosurgery residents choose not to go into pediatric neurosurgery. And one of them is shunts, ventriculoperitoneal shunts, which as an ER doctor, I'm sure you can sympathize with. But the other is parents. And again, getting back to this idea that neurosurgeons have this reputation for being gruff and not very personable and not really wanting to spend time with families. One of the things I saw again during my time with Dr. Manizas, but then, a year or two later when I had my first child, was what I started to see is that parents in the hospital with sick children, and neurosurgery patients are sometimes among the sickest, are responding in a way that's normal for a family that loves their child. And once you remember that, it becomes much easier to spend all the time in the world with that patient's family.
Yeah.
Even if it means answering the same question day after day after day, even if it means spending hours upon hours every day with the patient's family. They're not crazy. They're not trying to make your life difficult. They are behaving in a way that is normal for a family that loves their child. And that's a
You,
lesson I try and impart on my own trainees.
I really appreciate that. You had mentioned a little bit about um, the guilt of a family. I have experienced oftentimes in my setting in the pediatric ER tremendous guilt. Almost the first reaction a family has when a child is diagnosed with a tumor of the brain. And symptoms oftentimes have been chronic or intermittent over months and maybe even years. And we make the diagnosis, and oftentimes parents have guilt around that. And I'm curious, what is your approach to that on an emotional level? And how do you talk to families um, about that guilt?
Yeah, you're exactly right. I think, well, there's guilt in two ways. One is what you alluded to already, the delayed diagnosis. Would it have made a difference if we caught this 2 weeks ago, 3 months ago, a year ago, whenever these little symptoms started to develop? And I just try and reassure families that it wouldn't have made a difference. That all the treatments that we have, all the outcomes, everything we know about these tumors says that from the time they're diagnosed, there's certain things we can do, and diagnosing them earlier would not have necessarily made a difference. And the other thing is, you know, the symptoms, as you know, are very generic. They can be caused by a lot of different things. So just reassuring patients or reassuring families that there's no way they could have known that this is what it was going to be. But then the other thing that is really important is families, especially in our world of the internet and all this news about things you do during pregnancy or the way you treat your child early in life can lead to all these other problems. Reassuring families that there's nothing they did or didn't do that caused this or could have prevented it. That we don't know everything about what causes brain tumors, but what we do know is that there's nothing the mother did while she was pregnant. There's nothing they did while the child was young that caused this to happen or could have prevented it from happening.
Hmm.
And
Consi-
try and help them understand that this isn't on them.
so, considering the advances in biologics, considering the advances in oftentimes leukemia, 50, 60 years ago, if a child was diagnosed with leukemia, it would be a death sentence. And now we can cure 90% plus of childhood leukemias. Where is the state of practice and curative treatments in regard to tumors of the brain? I know there are multiple kinds of tumors and it depends on where it's located, but is the field of neurosurgery making significant advancements like with blood-borne tumors in your world?
Yeah, so there's two pieces of that. The surgical aspects are making advances, of which we introduce newer techniques and less invasive methods to take tumors out, but also better understanding which tumors really need to be resected versus those that don't. Tumors that are deep in the brain in particular can have a lot of morbidity associated with removing it. So understanding the genetics of the tumors and knowing which ones benefit from an aggressive resection versus those that don't really impacts what we do. But where the biggest advances have come are on the oncology side of it, and better understanding of the genetics of the tumors, subcategorizing tumors into genetic categories beyond just what the histology, what the appearance under a microscope tells us, and using that to help with prognosis and to design treatments. And then this whole flurry of immune modulating drugs and the monoclonal antibodies and everything else that have really been a real game changer for some sorts of tumors that we deal with. It's not a malignant tumor, but there's a tumor called a subependymal giant cell astrocytoma, SEGA, like the video game system, which is associated with tuberous sclerosis, which is a genetic condition. And this tumor grows right in the ventricles of the brain and can block spinal fluid flow and cause hydrocephalus, fluid buildup in the brain. And these used to always be surgical. I haven't operated on one in over a decade because there's a medication that works for it now and can shrink the tumor. So in some ways, the advances in medicine are actually saving patients from potentially morbid operations, which even as a surgeon, I'm glad for. I'm perfectly happy to not do surgery on people who don't need it anymore.
We've also made advances in when and when not to operate in the field of trauma as well.
Mm-hmm. Yep, for sure.
So I want to get back to a comment you made about the rep of a neurosurgeon, and I have really appreciated our relationship, and I think I've shared with you before. I worked in a small town. I was on call every other night for 5 years, and know what it's like to be on call for every other night in a busy practice where there was no call service and families had a direct access to me for Tylenol dosing and other things, and it was a busy practice in a rural environment. What do you think? Why is there that reputation? Is it the amount of work that needs to be done? Is it the fatigue? Is it dealing with difficult things like you do? What do you think makes up that reputation for neurosurgeons?
All of the above. I think it's a long, arduous process to get to be a neurosurgeon. 4 years of medical school, 7 years of residency, plus minus fellowship afterwards. And those residency years in particular are grueling. We work some of the longest hours in the hospital, and it beats you down after a while. Um, and you get compassion fatigue. And one of the first things to go, you have to learn how to operate. You have to learn your surgical indications. You have to learn complication management to get through. So one of the first things to go is missing out on those personal interactions, not just with patients, but with people you work with, nurses, physicians on other services, nurse practitioners, the whole gamut of people. I was fortunate to train in a residency program at Iowa where um, our faculty, and this was from the chairman on down, would not tolerate mistreating other people. And when it would happen, you would get gently corrected and um, about, no matter how hard you're working and how tired you are and how much you have to do, you still need to treat everybody with respect. And that was further modeled when I was in my fellowship in Toronto. And maybe that's because Canadians are famously nice people, but I also think it's because of the people I trained with and just because pediatric neurosurgery draws that sort of personality. And then out in practice, you know, there's a shortage of neurosurgeons around the country, and there's a shortage of pediatric neurosurgeons around the country, and they are not equitably distributed. So some places suffer more of a shortage than others, which means that there is sometimes an overwhelming amount of work that needs to be done. And again, you have to take care of the patients, you have to do the surgeries, you have to see the clinic patients, but you don't have to be really nice to people that you work with in order to get the job done and pay the bills. It helps, and it makes for smoother interactions and it improves patient care. But again, that's one of the first things to go, I think, is those personal interactions with other people.
Right. And I'm not familiar with your call schedule, but when you're on, you're on. And if there's an emergent surgery at 3 in the morning, you have to be available to operate at 3 in the morning. So I imagine part of it is disrupted sleep can
Hmm.
really create more emotional reactivity. And I'm very familiar with some of the literature in emergency medicine, which is a 24/7
Yep.
um, field. And folks that get disrupted sleep in my world can develop uh, difficulties with relationships with others, not only just colleagues, Greg, but also
Yep.
with people you love. And we was talking about this with one of our other guests, that facial surgeon, trauma surgeon of the face, that oftentimes it's the personal relationships that really suffer when you're fatigued. So,
Hmm. Yeah, and I think early on in my career, that's not something, balancing work and life, the work-life balance was something I was not as good at. Now, especially when I was on call, because, you know, going along with lack of sleep is that constant sense of, your cortisol levels, I imagine, are very high and your adrenaline is high, just knowing that something could happen at any time. And the further I've gotten in my career and the more comfortable I am being on call, knowing that I have the knowledge and the skills to respond to whatever's going to come my way, I'm able to relax on call and spend time with my family and spend quality time with my family. And having that life outside of work definitely helps me be a more balanced person at work too.
so are you in your world? Are you able to turn it off and be present with your children and your family when you're not working?
I would say I'm much better about it now than I was used to be, but I'm still not perfect at it. I still find myself checking on my patients in the hospital even when I'm not the one on call for a particular weekend. And a lot of that's because particularly when you do surgery on somebody, you feel you're invested in that patient's progress and their success. Um, so especially when, even when things have gone well, I like to know that things are continuing to go well in my absence, but even more so if there's been a complication or a problem, that we're actively dealing with. So I do have a hard time turning it off, but I'm a lot better than I used to be.
I appreciate that. At the end of the day, it's interesting, like with Dr. Manizas, he had all these families come and talk at his funeral, which is unusual, uh, and tell stories. There's also the legacy of our families, and I'm sure his family is missing him, and I think in medicine, I don't know what it is, but sometimes we forget about our families. And I remember when I was in training and I was starting a company, and then I was in the middle of, an academic world, but when I was back in Oregon, I remember my children saying to me from time to time, "Dad, you're always on your phone. Please get off your phone. I want you to be with me." And um, I think these devices have been incredible on so many levels, and they've really caused detriment in terms of how we, uh, at times, have a difficult time being present with our loved ones. What do you think about that?
100%. My wife reminds me of that constantly, especially, I mean, as you know, at our hospital, like many hospitals now with Epic and being able to access Epic on the phone, it used to be that I would actually have to pull my computer out and log in order to follow up on things and check on things. But now I can just pull up my phone and see what's going on with my patients at the hospital, or with the news or whatever's going on. So, my wife is much better at putting it down than I am. That's for sure.
Well, we're getting towards the end. I'm wondering if you could summarize a little bit, if you had to summarize one or two teaching points about what we talked about today. What would it be?
Yeah, so I'm going to go back, and these are things that I tell my residents. So I think there's really three things I want to say. Um, One is what I said before, where what's another day at work for us is a life-changing event for a patient and their family, and you can't lose sight of that. That every interaction you have with that family that day, they will remember and will impact them positively or negatively. And you want it to be a positive impact on their life and on the life of their family and their child. The other, another is that, you know, parents in stressful situations, they're going to demand a lot of your time. They're going to demand a lot of your attention. They're going to ask the same questions over and over and over again. And there's a tendency to think, well, this is annoying. That person's annoying. I don't want to deal with this. But you have to put yourself in their shoes. So you're a parent. I'm a parent. Many of my residents are parents. But even if you're not a parent yourself, just understand that that's how parents react when their child is sick. And I actually am at the point now where I get a little bit more worried when parents don't react that way, where they don't seem like they're interested or invested in what's going on with their child. But for the parents who really, want to talk to me for a long time, have a lot of questions, even if it's the same questions I answered the day before, that tells me that they're really invested and they really care and they want what's best for their child. And it's a normal reaction for somebody who loves their child. The third point, and this is from one of my co-residents that I didn't bring up, is that um, he used to say to our junior residents when we were chief residents together that whatever is hardest for you is probably best for the patient. And I try and remember this, especially on those call nights. I'm back and forth. Maybe I just got home, just getting back into bed, and I get another call, and I remind myself that what's hardest for me is best for the patient. And oftentimes what's hardest for me is to get up and go back into work and see that patient or do that surgery. But that's what's best for the patient. And that's what really matters when you're the physician on call or you're responsible for that patient.
That's really sage advice, and I appreciate you being on the show. I appreciate you being vulnerable, especially about your brother and about your relationship with Dr. Manizas. May he rest in peace. And he's given us a gift in you at Arkansas Children's, because I feel incredibly fortunate to be your colleague. And I feel like things are better. for the kids that we care for, because you're here and your leadership, and you're building your group, which is awesome. And most importantly, it's the children that really benefit from your care. So thank you for being on the show, and look forward to having you back on.
Well, thank you very much. It's been a pleasure. And thank you for all the work you do and your friendship and being a colleague at work.
All right, everyone. Thank you for joining today. If you enjoyed today's podcast, please hit subscribe. We're on YouTube, Spotify, Apple Podcasts. This is Dr. David Spiro saying goodbye from snowy Little Rock.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.